Ottawa says it's making it easier to treat opioid addictions. The announcement comes one day before a new report is expected to show 4,000 Canadians died in the opioid crisis just last year alone. Another 2,900 died in 2016. Health Minister Jeanette Petitpas-Taylor says it's time to remove the stigma that stops patients from seeking treatment, so the government will eliminate obstacles preventing doctors from offering prescription heroin and methadone. The changes are expected to come into effect in May. Petitpas-Taylor explained the changes on CTV's Power Play.
We're going to be allowing physicians to be able to prescribe methadone and also diacetylmorphine to their patients.
Heroin, basically, right?
That's exactly it. At this point in time, how it works, if a doctor wants to prescribe one of those two ingredients or those two prescriptions, they have to apply for an exemption through the Canadian, the CDSA, the Canadian Drugs and Substances Act. So at this point in time, what we're saying, we'll exempt that. They won't have to go through that process. And doctors will be able to have that conversation with their patients. And if they choose that that's a fitting alternative for a treatment, they'll be able to use that as a medication replacement therapy.
Let's bring in Dr. Hakique Virani. He is a public health, preventative medicine, and addiction specialist. He joins us now from Edmonton. Dr. Virani, quite the controversial announcement, do you think?
Well, I don't think so. If you look at the evidence that demonstrates that the medication options that the minister spoke about actually have good solid proof of effectiveness in terms not only of decreasing mortality from opioid addiction, but also improving social productivity and social engagement and reducing the costs to the healthcare system and the social sectors, it makes perfect sense that we should remove every obstacle to prescribing these medications to people who may benefit from them.
What would you say to folks who might come back and say, wait a second, why are we prescribing heroin and methadone? We know what this does to people. We know how dangerous these drugs are, and they're shaking their heads.
Well, it's exactly because we know what these medications do. They save lives, not only from the risk of overdose, but also from the risk of all other health hazards that patients who struggle with opioid addiction are faced with. And so it's exactly because we know what these medications do that we need to provide better access to them for the treatment of a health condition.
Dr. Virani, the opioid epidemic in Canada, quite the sensational headlines, alarming at best, or at worst, I should say. This has been going on for quite some time. What do you make of the timeline of this announcement today?
Well, looking back, the recommendation to remove the regulatory requirement to prescribe methadone was one that we made in 2013 when the Canadian Centres on Substance Use and Addiction had assembled a group of experts to discuss Canada's prescription drug crisis. And in a report called First Do No Harm, we recommended this 5 years ago. So it is frustrating that it's taken an epidemic of overdose deaths to see that recommendation finally acted upon. And unfortunately, all of the movements that are made around this epidemic have been really, really slow. And unfortunately, while these moves do remove some obstacles to prescribing treatment for opioid addiction, they don't do anything to remove the obstacles for patients to seek out treatment. It's very difficult to go and disclose to your doctor that you're using a substance that by definition makes you a criminal. And until we deal with a fundamental flaw in our drug policy, don't expect to see these changes make a huge dent in a public health emergency. We need to be much bolder, and we need to deal with drug policy to the extent to decriminalize substance use.
Dr. Virani, quick question if I can. Do you think your colleagues will follow suit and be as supportive of this measure as you are?
Well, I hope so. I think that we're recognizing in emergency departments, in primary care practices, and at virtually every touch point in the healthcare system and outside, that this very much is a public health emergency affecting every single demographic. And until we use science to deal with this problem, we're going to continue to struggle with it. 4,000 people died from a preventable cause of death in one of the richest countries in the world, and that's just indefensible. So until we change our paradigm, we're not going to get a grip on this.
Okay, we'll have to leave it there. Dr. Hakique Virani, public health, preventative medicine, and addiction specialist, thank you.
You're welcome.